We are interested in a transparent, accountable, and clear system of admission into KMTCs across the country. Every Kenyan who qualifies to go into those programs should go. We should not manipulate the system, and we are going to fight it. When we work together with my colleague at the Ministry of Health, the system we are going to put together will deal both with the statutory confusion, which has provided refuge for those who want to manipulate the system, and we will deal with aspects of it that sometimes are opaque. We do not want Kenyans who qualify to get into these programs to be disadvantaged unfairly because they need to know someone somewhere for them to be admitted. We have tripled this year the allocation we are setting aside for technical and vocational training institutions to about 1 billion shillings, up from where we started last year of 300 million shillings. The challenge, however, is that the uptake is not as good as we want it to be, and I'm asking the Higher Education Loans Board to conduct a very strong campaign this year to ensure that wherever our young people are in technical training institutions across the country, they understand that they do not have to suffer. They can apply for these funds and we can support them to complete their education. It's important, and that's the reason why we are putting these resources together.
In our presentation here, to serve as health workers are supported to train and be deployed to provide healthcare services where they are needed in this country. Therefore, at this early stage, I take the opportunity to urge the management and the committee, Afya Elimu Fund Oversight Committee, apart from granting scholarships, to work out mechanisms to ensure affirmative action, because when we look at the distribution, there are counties which need this stuff and they are not well catered for. It is those counties which we want to focus to develop manpower, people who are going to work there, because they also suffer from the attrition rate in those counties. Therefore, to bridge the human resource gap, the government is supporting students undertaking courses in private training institutions, something which emerging as a policy of government to be able to provide education and education training to Kenyans, whether they're in public institutions or in private institutions. That is part of equity and access. In particular, Funzo, through the support of USAID, is supporting students joining middle-level healthcare training institutions. In the last 3 years, we have expanded our colleges to respond to this growing need and policy direction of government.
And we know that there is no shortage of bright and dedicated young Kenyans who are ready to serve their community. They're ready to step up and meet this demand, and certainly William and Mercy are two of them. But the students do not have the resources they need to pay for professional health training. And so we really do have a challenge in front of us. The challenge is to help Kenyans have the means to enroll and complete training that allows them to take full advantage of their talents and to start meaningful and needed careers in health.
Every time, when the Afya Elimu Fund was announced in our school, it was a good opportunity for me. I applied and I was given 40,000 shillings, and it gave me hope. So ladies and gentlemen, I'm grateful to God today as we launch Afya Elimu Fund. This is the best assurance I could ever receive that I will complete my studies. I know I speak not for myself, but for thousands of other students in my college and other institutions with a passion to serve patients, but whose only obstacle is to pursue their dreams is the financial status.
A round of applause, ladies and gentlemen. The beneficiaries are getting a photo op with Dr. Brett Matiani, Cabinet Secretary for the Ministry of Education at this point. We ask you to take your seats again. And please smile. Where are the smiles? There we well done on all the hard work. Please take... Okay, just a few minutes before we are...
It already happens in countries like America, so we think in this country it should also be able to happen. So ladies and gentlemen, I hope that has given you a synopsis of...
Quite seriously, because time is not on our side. Now, of course, 85% of the college, to give us an overview of this. Welcome, Mr. Tuma.
Ministry of Education, Ambassador Robert Kodek, United States of America. Let me begin by thanking all the founding partners for the very idea of starting this fund.
I said to people, before even have a call to action, they already heeded the call and they're going to be for us. Thank you so much for the stage and all the support. And I think healthcare industry is set.
1,000 shillings. If you can, like I say, please open the platform, fill it out, and let's try and make a difference.